Hello and welcome to my channel. In this video, I'm going to give you an overview of OSCE as an adult nurse. What are you going to be expecting during your OSCE station? This video is going to help you to be fully confident whilst you prepare for your OSCE exam. For starters, you are supposed to do 10 stations. During your OSCE, you are supposed to present on 10 different stations. There are 4 fused stations depending on the scenario that you get. So the 4 fused stations are assessment, planning, implementation, and then evaluation. That is called a pie together. With the assessment, it is going to be given to you in the form of a person who has been admitted to your ward with a particular condition. Let's assume the patient has got pneumonia and has been admitted to your ward. With a patient who has got pneumonia and has been admitted to your ward, during your assessment station, you are doing the A to E assessment, which is the airway, breathing, circulation, disability, and exposure, which entails airway. You are obviously checking for the airway if there's any obstruction whatsoever. And when you go to breathing, you are checking the respiration of your patient. And also when we get to the circulation, you are going to be checking the pulse rate, the capillary refill, any form of pallor or perfusion, and the blood pressure. Not forgetting, you are also going to be checking the oxygen saturation of your patient. Moving on to the disability, you are checking the alertness of your patient, the ACPVU, making sure that if the patient is in any pain whatsoever, you would also note that in disability. Ask your patient if they've passed urine or emptied their bowels, or has their blood glucose been checked, and you move on to exposure. When it comes to exposure, you are checking the temperature of your patient. Using the infrared thermometer to point on the head of your patient to check the temperature of your patient. During your assessment station, you are going to be doing this as I explained. Then you go to the next step, which is the holistic assessment. It is more or less like history taking. Your patient presented with a particular complaint. Your patient has past medical history, social history, allergies. You are going to confirm from your patient if those details that you have are accurate. You are also checking if the patient has got any referrals that you might need to do for the patient. This is the thing you need to do in the assessment station. You check the observation of your patient using the A to E assessment, and then you go ahead to proceed to the holistic assessment. Take history. If the patient has any surgeries that are not mentioned in the overview, you are going to ask the patient. If the patient has got any wounds or bruises, find that out and note it. That is the assessment station. Now, let's move on to planning. The OSCE station planning can give you a scenario with particular problems that they are expecting you to deduce or prioritize from the patient's presented complaints. So you can either pick the problems from the scenario given to you, or you can pick the problems from the presenting complaints of your patient. In planning, prioritize the patient's problem and select 2 relevant problems and solve the planning scenario for them. So your patient has been admitted, you've checked their vital signs, you've done the history taking, you go ahead to do the planning station. In the planning station, you select the problems from the presenting complaints, and you've noticed that the patient presented with shortness of breath, loss of appetite, chest pain, and an impaired mobility. Obviously, with your nursing discretion, which of these 2 are you going to choose? Right. So you are going to prioritize the problems, and we can choose chest pain and then shortness of breath for this patient. One of the key things you need to pay attention to is if you don't prioritize the problem, you can be marked down. In your planning station, you are writing the aim of the problem, you are stating the problem, and you are also giving a nursing intervention for the problem. Let's move on to implementation. In implementation station, you are administering tablets to your patient. The patient was admitted, you've planned a care for them. The next thing for you to do is to administer their prescribed medication in the implementation station. The next thing in the overview is the evaluation. In evaluation, you are handing over the patient's care to either your colleague nurse, to a different department. Let's say you are in the A&E and then the patient was admitted. You are supposed to transfer the patient to the ward. So in this regard, you are handing over the patient's care from your unit to the different unit. You can either make a call or just hand over directly differently depending on the scenario. With the 4 stations done, you have 6 more to go. Remember, you are supposed to do 10 stations. What are you going to be getting again? Now, we have 4 clinical skills that will be given to you as an adult nurse in your OSCE. 4 clinical skills entails a lot. You have over 22 or 23 clinical skills to study, and then you will be expecting 4 of them. Don't panic. You are going to get a performing station such as intramuscular injection, administration of inhaled medication, subcutaneous injection, or blood glucose monitoring. Silent station can either be fluid balance or pressure area assessment. In silent station, you are not talking. I bet some people will be wishing to get silent station all the time. No, you are not going to get silent station throughout your OSCE. In silent station, you are just going to be timed, and then you start to proceed and do your station. And then as soon as your time is up, the assessor will come for the paper. For the clinical skills, you can either get performing or a silent station. Definitely, you are going to be getting a performing station. Don't look at getting silent stations only. You have 8 stations done now, and you have to get 2 extra stations in order to make it 10. And you have your professional value. As a professional nurse, what are the values of your profession that you would pay much attention to when it comes to your OSCE presentation? They can give you a scenario, something like hospital food. So you are in the ward, and then your colleague nurse or a different person has taken your patient's food. Your code of ethics as a nurse, as a professional, what are you supposed to be doing about this scenario? You are going to definitely report, and you are also going to ensure that the patient is safe, isn't it? So you might find food for your patient and all of that. That is professional value. Evidence-based practice is the last thing. In evidence-based practice, they are going to give you a scenario. It's going to be compared to the research or the findings that has been done about the scenario. Let's say your patient refused to take ibuprofen instead of paracetamol because they think ibuprofen works better on ankle sprain more than paracetamol. If this is the case, you need an evidence to back whatever the patient is saying and the reason why they are saying that. The article will be given to you in your OSCE station, and then you will deduce the bullet points out of this station. This is the overview of your OSCE. As an adult nurse, what are you going to be getting? You are getting 10 stations: assessment, planning, implementation, and evaluation fused together. So if you get a scenario like pneumonia, you are doing this on the patient with pneumonia. All the 4 stations will be done for the same patient with pneumonia. And then you proceed to the clinical skills, where you will get 4 clinical skills out of the many you are going to study. It can either be a performing station or a silent station. The last thing is you are going to be getting 2 silent stations, that is professional value and then evidence-based practice. If this video helped you, pass a comment in the comment section. In order to pass your OSCE, you have to make note of all these points that I've said. This is going to give you the fair idea of what to expect during your OSCE station. Do well to subscribe, like, and share these videos to your OSCE buddies, your nurses who are preparing for their exam. Thank you, and let's pass together.